News Center Maine is partnering with the Maine-Monitor to bring you some of the reporting being done by the independent nonprofit publication. We'll be bringing you one of their stories each Monday. Today, an effort by state officials to untether Maine from healthcare decisions made in recent months by the Trump administration, including a reduction in the number of vaccines recommended. It comes as Maine grapples with its first case of measles since 2019. Lawmakers in Augusta considered two bills last week that would increase access to vaccines. Here to talk about the legislation is Rose Lundy, a senior public health reporter for the Maine-Monitor, which recently published her story on this topic. Hi, Rose. Thanks for being with us.
Thank you for having me.
Of course. Okay, let's first talk about LD 2146, which would expand which recommendations the Maine Vaccine Board considers for the state's immunization program. Tell us about the proposed changes here.
Yeah, so like you said, this bill would change the recommendations that the Maine Vaccine Board considers when making its annual determination for the state immunization program. Right now, the board considers recommendations from the U.S. Department of Health and Human Services. This bill would allow the board to consider three additional trusted national medical associations. They could look at the recommendations from those associations. And supporters of the bill say that this is important in the event that the federal government continues to reduce the number of vaccines it recommends for the routine childhood schedule. And if then it would allow the board to continue to consider what they say are longstanding science-based standards for vaccine recommendations.
Is there any opposition to the bill?
So during the public hearing, no one spoke against it, but the director of the Maine Center for Disease Control and Prevention submitted testimony saying that she supported the idea behind the bill, but that in practice, the way it's written, it would actually make it harder for the board to have neutrality and flexibility and be able to respond to evolving public health emergencies.
Okay, let's turn to LD 2071, which would then expand access to vaccines through pharmacists. So, what would this bill do, and why do supporters think this one's necessary?
Yeah, so this bill would allow pharmacists to prescribe and administer vaccines to any adult without needing a prescription from their doctor. It also would allow them to administer a vaccine to children over the age of 6 months for specifically COVID-19 and influenza. And it would allow pharmacists to administer a vaccine to children who are 3 and older if they have a prescription. In addition, it would require insurance carriers and MaineCare to cover vaccines without a deductible coinsurance or a copayment. So, a Republican lawmaker who co-sponsored the bill said that this is necessary to ensure that people who want to get vaccines can find it accessible and affordable.
Okay, so a few things there to follow along with. Thank you, Rose.
Thank you for having me.
Of course. And you can read Rose's full story and more at the-maine-monitor.org.